You're listening to Rise Above, a Rogers behavioral health podcast, where we sit down with Rogers experts who are changing the way the world views mental health and addiction.
I want to do an experiment. I'm not a scientist. I don't know if this is going to work, but we'll give it a shot. Ooh, music. I like that. All right, great. We're going to do an experiment with music. I want you to close your eyes. I want you to imagine a therapy session. What does a therapy session look like to you? What does the room look like? What color are the walls? What color is the couch? Is there a couch? Is the therapist writing things in a notebook? Do they have a laptop open? Now, I would guess that most of you pictured two people in a room, one of them talking, telling their problems to the other. All right, open your eyes. Now, what if I told you that that is a bit of an outdated thought process on what therapy is? Mental health treatment has changed over the years, and here to talk to me about how therapy and mental health treatment is changing is Signa Meyers from Rogers Behavioral Health. Signa, thanks so much for joining us.
Thanks for having me.
So, yeah, let's talk about traditional therapy. And I guess it's not what a lot of people envision in their head, right?
Over the past 2 decades, the face of behavioral health has really changed. And what people traditionally see on TV or in media isn't really what happens in the real world. For example, there's just more increased accessibility. You can access therapists, psychiatrists in lots of different settings more now than ever. There's more diverse approaches. I think the traditional model, when you think about therapists, it's a person laying there on a couch and someone, taking notes. And really, that's not what therapy looks like. Therapists and psychiatrists and psychologists are using more evidence-based practices. And by evidence-based, I mean something that has been tried and true. It's not just talking to talk. We're actually talking to our patients with a goal in mind. We measure success. We measure it over time. The goal of therapy is really to get better. And we have to measure that progress. And so we want to take what we're calling evidence-based approaches, which are really the gold standard right now. And another thing that's changed, I would say, is an emphasis on wellness. We really want to talk about people as a whole person, not just about their quote unquote problems, but how do you go back to, your family, your work, your community, and be the best you can be. And yeah, it may involve working on your depression or anxiety, but it could be something as simple as, stress management or coping skills or marital relationships. So I think it's way more diverse and more open than we would normally think that the media portrays it.
And I'm guessing that things have changed quite a bit since the pandemic as well.
Absolutely. One of the things we were faced with during the pandemic is we had shelter-in-place orders. Not only were patients told to stay at home, but workers were told to stay at home. And so at Rogers, we had to figure out, how do we continue to meet the need of people with behavioral health needs? So we implemented what we're calling telehealth. We were doing telehealth prior to the pandemic, but it just really expanded and exploded throughout the nation during the pandemic.
So what exactly does that mean? What does telehealth mean then?
Sure, yes. Telehealth is a generic word that really means accessing your healthcare through virtual means. And healthcare can mean physical health, it can mean mental health. And when I say virtual, I mean through your computer, through your laptop, through your smartphone, through a tablet. So at Rogers, we do telebehavioral health, which is meeting with your treatment team for your behavioral health needs virtually through whatever technology that you have available to you.
And it's not just meeting with your therapist, it's like group sessions as well and things like that, right?
Absolutely. At At Rogers, we offer a continuum of services that is all the way from meeting one-on-one with your therapist all the way to group sessions where you're in working with your therapist and treatment team several hours a day. And so you're able to really flex depending on your individual needs, kind of what level of care you need.
Okay, so I'm imagining that I'm taking therapy and I'm it's not Zoom, but it's that type of thing. It's not.
Sure.
But is it difficult? Would it be difficult to like connect with your therapist? I imagine it might be.
I guess it depends by what you mean by difficult. There's the actual difficulty, like, can I click on the link? Do I have Wi-Fi access? Do I have the technology? I guess that depends. But if you're talking about connecting, like rapport building, like feeling like you're making empathetic connection with your therapist, then it depends on the person. We found through the pandemic that people felt more connected to their treatment team during the pandemic than they did in person settings, or it was just as feeling connected as in person. So some of the myths we had prior to the pandemic, like, oh, you can't have as good as outcomes, you can't connect with your treatment team, were really dispelled during the pandemic because we did ask our patients at Rogers, do you feel connected? Do you feel heard? Do you feel that your therapist is listening to you? And all of those were a resounding yes.
I also think, okay, so at Rogers, you treat a lot of different cases. Is there a specific type of patient, like maybe someone struggling with OCD or an eating disorder or something along those lines that works better for telehealth?
I guess it depends on the person. We can treat people with anxiety, depression, substance abuse disorders, OCD, and trauma, just as well as in person when we're doing it in the virtual setting. It really is up to that individual patient. Are they willing to be seen virtually? And because we have seen, like I said, when we go back to evidence-based approaches, the evidence is there to show that the outcomes for patients getting better are just as good as when you're in person. So if you have the will and the equipment and the ability to connect, then we can treat you.
And are there like common questions that people ask before getting into this type of treatment?
I think there's a lot of questions people ask. I mean, people want to ask, will insurance cover this? How do I know that my session is secure and private and people aren't listening? And, talking about privacy and security, all of the platforms we use at Rogers are HIPAA compliant. HIPAA is the highest standard for privacy you can have. We don't record our sessions, and we make sure that not only in a group setting is everyone understanding the confidentiality, but we also have people sign our privacy and confidentiality agreements because we know it's really important. Just like in person, we don't want people breaking privacy. That's the same online.
So this is not exactly a new way to treat people, but it's growing, right?
It is definitely growing. I think through the pandemic, we found that we could access people that wouldn't normally be able to access treatment due to their work schedules, due to transportation issues, due to childcare issues. When you open up telehealth to people that really need emotional stability, the sky's the limit.
So this sounds like a great option for patients. What have you heard from therapists working in this setting? I mean, does it work for them?
I think it's divided. We have, especially during the pandemic, people that were really leaned into it. They loved it. They loved the convenience of a 1-minute commute to the office versus a 20-minute. But then there were other therapists that really never felt that they could fully separate the work-life balance and wanted to come into that physical office. So I think the people that we hire for our telehealth programs at Rogers are people that have really understood the benefits, not only for them and their family, but also of meeting the needs of the wider community and really have leaned into the concept of telehealth. So I wouldn't say all treatment providers love it, but for those that do, they really do lean into it and embrace it.
So telehealth is not just a Rogers option, but what sets Rogers apart when it comes to it?
Yeah, so what sets Rogers apart is not only are we an organization that's over 115 years old, but we don't just provide telehealth services. Going back to my initial statement around Rogers offering a continuum of care, we offer the full continuum of care for behavioral health. And let me talk a little bit about what that means and why that's important. The continuum of care means we treat patients no matter where they are in their behavioral health journey, all the way to very acute and suicidal to just seeking some preventative measures to help them with their daily life. So we offer inpatient level of care where people are staying there overnight, as well as residential. We also offer partial hospitalization and intensive outpatient, all the way to outpatient. Why that sets us apart in the telehealth space is you could start off at telehealth with us and you may become more acute and want a higher level of care. So we can treat you at that higher level of care in person or virtually. We have lots of offerings to give you, including specialty treatment for eating disorder and substance abuse, and the list goes on, but also the different levels of care. And I think that's really beneficial to the patient because they're not being switched between providers. No matter where you are, you get to stay in the Rogers system.
Okay, so someone's listening to this podcast and they think maybe telehealth might be a great option for them. Can they just sign up for telehealth if they contact Rogers?
When you call our 1-800 number or fill out an inquiry form on our website, you can actually say that you prefer telehealth, and our screeners will note that in your file, and you will be then assessed through that lens of telehealth. At Rogers, we really want to meet you where you're at. And if the drive is too long, if you just don't want to come in person, or for whatever other reason, we want to meet you where you're at. And so if you prefer telehealth, we're going to try to meet those needs. Rogers is really dedicated to telehealth. We are positioned to grow telehealth in several states in the future. So if we don't already offer telehealth in your state, please keep an eye out because it will be coming soon.
Well, Signa, thank you so much for taking the time out of your day to talk to me about this. And anything else you want to let listeners know?
I would just say, one of the things that I think is really important when people are looking for a behavioral health center or provider is not all approaches are going to be right for you. You need to do your research, just like you would interview a doctor. You really need to do your research on the companies that you're going to be involved in, and telehealth may or may not be right for you. Behavioral health is not a one-size-fits-all treatment. What works for your neighbor may not work for you. And if telehealth works for you, great. If in person works for you, great. The biggest take home is that we all want to get treatment for our emotional needs. And if Rogers and telehealth is that place for you, we are happy to have you.
Thank you again, Signa. I appreciate your time.
Thank you.
Thanks for listening to Rise Above, a podcast from Rogers Behavioral Health. Be sure to like and subscribe to be notified of new episodes. As always, if you or someone you care about is struggling with a mental health or substance use disorder, visit rogersbh.org for a free mental health screening.